BC health officials are planning to vaccinate every adult residing in Prince Rupert by April 1st. That's just a few weeks away. With a population of 12,000, 1.6% of Prince Rupert residents have recently tested positive for COVID-19. That's considered dangerously high compared to other similar communities. At the same time, results of a new poll suggest residents in northern BC are more hesitant to get vaccinated. With us now is Dr. Jong Kim, the acting chief medical officer of BC's Northern Health Authority. Dr. Kim, thanks so much for joining us tonight. I want to ask you, first of all, the whole community approach on vaccinations is usually reserved for those communities with populations of fewer than 4,000. As we said, Prince Rupert is at 12,000. So why are the immunizations there being fast-tracked?
Thank you for asking. In those whole community kind of approach that you mentioned, is usually resolve the community, especially in the early part of BC vaccination for the remote communities. So we try to achieve the herd immunity and protect everybody there, because accessing the healthcare in those communities is challenging. Prince Rupert is a little bit different situation. One part is that because of the rapid transmission of COVID-19 in a relatively sizable community that's at the risk of overwhelming local healthcare capacity, we are targeting not just kind of morbidity and mortality, those people who can get very sick from the COVID-19. We are also targeting those people who can actually spread COVID-19 in the community. So we are going with the whole community approach so that we can achieve that herd immunity in that community so everybody is protected.
So obviously you're hoping the expanded approach is going to reduce transmissions, outbreaks, clusters, those kinds of things.
Yeah.
Okay. So, and what's been the reaction to Prince Rupert getting this prioritized approach?
I think there has been, like, the Prince Rupert as a community, that people in the community knows that the community has been going through significant COVID-19 situations. So I'm sure there are mixed kind of reaction from the community, but we've been hearing kind of sense of relief that the vaccination is coming, in addition to other measures that community has been taking to control this situation.
Okay, well, let's talk about this recent poll that was done. It showed that the number of people who plan to refuse a vaccine is 2 times higher in northern BC, 20% of residents than other parts of our province. How do you plan to try to address that?
I think the key part is that there are people who are against the vaccination, and there are people who are hesitant about the vaccinations. So just continue to have that Northern Health as communication strategy with the community, both through our kind of social media website, as well as some of the kind of meetings and some of the kind of media release, that reassuring that the COVID vaccine is effective in saving life, as well as it's safe and went through the rigorous process that all approved the vaccine that's coming to the community. And we are just increasing this opportunity for engagements with the community to continue to build the trust that people need to have for the healthcare providers and health authority. And we are also working with our local healthcare providers for that, for people to feel more comfortable about the vaccination.
All right, Dr. Kim, we will leave it at that. We thank you very much for your time tonight. We appreciate it.
Thank you very much.